Hey everyone, I'm presenting on feminist theory and applying it to group therapy. I hope you enjoy this presentation and I look forward to discussing it more in class. So first we will look at part one of this assignment and understanding feminist theory. Okay, so some history. So first, feminist history has its roots in the feminist and equal rights movements of the 1960s. And feminist theory recognizes the impact that social practices have on personal well-being. Second, a big part of what erupted from the 1960s and the feminist movement of that time, very interestingly, was something called CR groups, which are consciousness raising groups. So it actually started as a group mentality in the first place, this perspective or orientation. And these groups were basically non-hierarchical leaderless groups in which women met to discuss their experiences as women. And consciousness raising groups resulted in the analysis of patriarchal and oppressive societal arrangements. And the goal of consciousness raising groups was societal transformation rather than individual adjustment. And two basic assumptions of psychological thinking at that time were challenged. And that was A, that a woman's distress is personal, meaning that it can't be attributed to anything else besides the person, the woman, taking responsibility for it. And B, the distress can only be alleviated by experts. So these consciousness raising groups really challenged both of those ideas by one, having distress be alleviated by one another, and two, that it was actually not the distress that was happening wasn't as a result of the individuals, actually stemming from a larger systemic issue. Okay, so here are some key concepts that I am going to talk about. So the biggest one, something that's pretty well known in feminist theory, is the saying, the personal is political. And feminist theory recognizes that the impact that social practices has on personal well-being and embraces the conviction that the personal is political. Meaning that the experience one has in their personal life is often a result of the institutionalized policies that either work to empower or oppress you based on your gender, your SES, your class, sexuality, etc. In feminist therapy, there's no lasting individual change without social change. Clients are enmeshed in their socio-political and cultural contexts, and true and lasting psychological change must address the issues within these contexts as well as the individual issues. As well, in feminist therapy and counseling, symptoms of distress are understood that the individual's attempt to communicate her life experiences and the strategies she uses for coping with the oppression she experiences. So, yeah, and taking a look at this slide, some of the concepts is the attention to diversity of women's personal and societal identities is something that is often addressed, a consciousness raising approach, an egalitarian relationship between the client and the therapist, and that's something we'll talk about a little bit later. Just to talk a little bit more about that point, the attention to diversity and women's personal and societal identities is the intersection of women's multiple identities is something that's examined further. And in the consciousness raising approach, moment. So clients are helped to differentiate between the politics of the sexist, racist, or homophobic societal structures that influence their lives and those problems over which they have realistic control. So there's an intrapsychic causation for problems in living is supplemented by exploration of gender role messages mediated by their culture, societal expectations, and institutionalized sexism and racism and homophobia. So in the egalitarian relationship between client and counselor, the client is encouraged to set personal goals and trust her own experience and judgment. And power differentials between the client and therapist are minimized by being extremely transparent about them as the counselor. So a lot of sort of the women valuing and self-validating process is kind of just like a focus on communal qualities of interdependence and concern for others, valuing of emotional expression and cooperation, something that is not necessarily valued much in our current patriarchal society. So these are strengths and to sort of encourage as the counselor and to examine and really looking at language that has formed that often devalues women. So we look at language in reframing language around that. So empowerment leads to resilience is kind of the goal, one of the goals of feminist therapy. So the overall goals of personal and social empowerment emphasize strength and resilience in coping with past, current, and future trauma and stress. And over here, I just have a little triangle that has common therapeutic techniques in feminist theory. So we have gender role analysis. That's something that the client and therapists do together in exploring how societal roles have influenced their lives, or exploring how the client's societal roles have influenced their lives. Similar is power analysis, which is the difference between oppressed and dominant groups. So exploring where you fit into that. Are you part of the oppressed group? Are you part of the dominant group? How have you, if you are a part of the dominant group, how have you related to the oppressed group? How have you caused oppression, and vice versa? So then we have a cultural analysis. It's a very similar type of kind of like self-assessment and processing with the therapist. And then we have demystifying methods, which clients are provided with transparency about the therapeutic process, which reduces power dynamics and empowers the client to give full evaluation and monitoring of their own progress. And then a lot of feminist theory and technique is a lot of adaptation of other techniques, psychodrama, CBT, etc. Really, you can use and pull from multiple different theories and orientations and put on your sort of feminist lens and see, use those interventions while using a feminist lens. Okay, so the role of the group leader. So we have some terms up here on the slide. We have an egalitarian relationship. That's the ideal to sort of strive for. That therapy is a collaborative process in which clients are considered experts on themselves. Counselors are experts, but only based in their specialized training. So that's our knowledge of human behavior, of therapy, and institutionalized oppression, as well as knowledge and awareness of our own life experiences. Also within that is that the feminist therapist really tries to minimize power differentials between their clients. Feminist therapists believe that therapy is a value-laden process and that you cannot actually be a neutral therapist. Therefore, a feminist group leader would make their values known to their clients at the beginning of counseling. And it's really encouraged for clients to make their own informed decision to work with this particular therapist based on what they heard. And therapists really encourage clients to shop around and find a therapist, counselor that they feel will work for them. So counseling goals are also collaborative and determined by the counselor and the client. And then counselors use selective disclosure when relevant to client issues and self-involvement. So they sort of share here and now reactions with clients. In a group therapy, if a participant is sharing something, it would be on par with feminist therapy for that counselor to share their immediate feeling in the moment of what they just heard. So a good sort of description that I found is this quote up here. It says, the objective, emotionally distant expert therapist model of many traditions, white Westerners, male perspectives, are replaced by a model that emphasizes empathy, nurturance, and mutual respect. So structure and safety. So a big part of the group leader is that they bear the responsibility to create structure and which then creates safety. And there's a lot of role modeling that happens that the counselor portrays, so that group members sort of recognize their own responsibility for learning and for moving themselves each toward sort of optimal mental health. One thing that I found really interesting is client transference is dealt differently. Clients' here and now experience of you is not necessarily treated as a transfer of a previous experience or relationship, but rather the counselor would affirm the client's legitimacy of the here and now experience of you. I found that really interesting, and I really enjoyed that. The counselor and client relationship is explored together, and the counselor is open to client feedback. Okay, so some strengths and weaknesses. Some strengths of feminist theory, transferable to many treatment and techniques, views client and client challenges holistically, views client as the expert, transformation on the societal level, not just on the individual or group level. So it really works to become an advocate for a larger group and society as a whole, and centers women's issues. So some weaknesses. So historically, the focus was on sexism and not racism, which excluded BIPOC's experiences, a variety of perspectives and thought within feminist theory. So there are a lot of differing perspectives and theories and arguments that can happen within feminist theory, which can sort of take from the original purpose or the power of the original purpose. So there's limited research on the efficacy of feminist therapy. And also I wrote centers women's issues that could potentially be problematic and sort of historically also being looking at things with a very binary perspective, binary gendered perspective. Okay, so multiculturalism and diversity. So in the last slide, I did talk a little bit about the weakness, that being that it was centered around sexism and not necessarily around racism. So here there's been a huge push for feminist therapists to be sensitive to and knowledgeable about multiple issues important to women of color. So In the past decade, feminist theorists and practitioners have responded now to criticism by feminists of color and have begun to be more inclusive of the issues of race and ethnicity and of social class. So as of now, it's a pretty inclusive and open dialogue that's being had between white feminists and Black feminists, and especially in issues with counseling. So as well, there's also been a push to be inclusive of more gender-aware therapy that emerged in the early 1990s and looked at societal context and considerations, considered gender central to mental health, and asked for involvement in active change and focused on collaboration between counselor and client in therapy. And as feminist therapy moved into the 21st century, there was more of a push for feminists and women of color to not be isolated and excluded as clients, as therapists, as researchers, as clinicians, and as educators within the counseling field. So a lot of we got a lot of Black researchers and literature that came out around that time, which produced some different sort of race-centered theories within the feminist paradigm. So here is one that Black feminists propose, Jones and Harris, right? Theories and practice and interventions that assist Black women in discerning their personal struggles from the structural constraints of racism, sexism, classism, and homophobia, thereby moving their life situations from models of pathology to those of wellness. So these therapeutic frameworks developed from a Black feminist perspective help Black women recognize how internalization of stereotypes and detrimental notions of Black womanhood contribute to their negative psychological symptoms, such as depression, anxiety, low self-esteem, and a decreased sense of mastery and control. So again, here are some of the Black feminist therapy structural components, as well as some of the Black feminist therapy core components. Okay, so now we're in part 2, and we are going to apply feminist theory, an application to the case of Joe. Okay, so feminist theory would look at Joe and the group as a smaller interpretation of the microcosm of society. So feminist theory would look into Joe's identity, which included his gender, his race, class, and understand his problems as a result of the systems in place that have worked to cause him stress in his life, which have led to his presenting issues of anxiety. The case describes Joe as a 24-year-old male. What we do not know is his race and sexual orientation, among other things related to his social makeup. So, however, in assuming he is a cis male, we can assume his gender to be one of the major contributing factors that have caused him distress. According to feminist theory, men also experience oppression and suffering due to the societal patriarchal gender norms that are in place to work against individuals to become empowered to encompass the full range of human characteristics, to experience masculinity all the way to femininity, and everywhere in between and beyond, and forward and backward. His behavior is indicative of entitlement and privilege within the group, which is often granted to cis males in our society. So Joe also centers his experience by taking or talking over others and not allowing others to give him feedback or advice. He's also very hostile to other group members, using curse words and etc. He presents with the theme of denying support and invalidating advice from his previous therapist and now currently, as we are seeing in the group, denying advice from other group members. It's almost as if he does not think these techniques have any validity to them. And this could be because the techniques that are offered require Joe to experience measures of vulnerability and openness, which are characteristically traditionally associated with femininity and womanhood qualities, as Joe would think within the social context or social construction of womanness. Joe does not value these qualities because he has internalized a societal message that maleness is greater and more valued than femaleness. And because he has benefited from being a man in our society, it's more difficult for him to see his experience as being a victim of patriarchal societal standards. So he still very much is operating from a gender binary, one in which favors men's experiences, and as a result, experiencing anxiety because of the extreme pressure to live up to the social construction of a man. Okay, so directing group therapy. All right, so here we have Joe, we have Anna joining us, and we have Kyle. So the facilitator's role, my role. So my role would be to provide structure and safety and role modeling so that group members understand their own responsibility for learning and to provide that modeling for optimal health and relational health. I would also be respectfully and safely raising issues of social justice, power, and equity in the group. And I would have already assumed to be transparent about my own cultural makeup, stating how my whiteness and my cisgendered femaleness shows up in the group. So I would be exploring gender imbalances instead of liking Joe's anxiety or instead of Joe's, I would sort of look at Joe's anxiety as the experience we would focus on after we, focused on exploring sort of power imbalances within the group. And I would try to connect the two or connect that to his anxiety later. So I would maybe reflect to Joe how he's not been taking responsibility for his own healing. He seems to believe it's someone else's responsibility to do the labor for him to cure his anxiety. We would explore why this is, and I would ask Kyle if he has ever shared this experience with Joe as another man. We would sort of maybe, I would direct the group in talking about internalized gendered expectations and ask Joe and Kyle if they'd be willing to share what their experience has been like as a cis man. And I would ask and see if they could maybe talk amongst each other and ask if they relate to each other in these experiences at all. I think this would bring a lot of awareness to Joe and where he is socially as a cisgendered male, because he's not necessarily showing that he has much awareness of the power structures that his social makeup implies. So similarly, I would bring Anna into the group as well. And I would reflect to Anna and notice that my observation, which is the use of immediacy, that I've noticed that she's been cut off by Joe a lot. And I would ask if she's sort of ever experienced this before when speaking to another man, and ask her just a general question, open-ended, what comes up for you when that happens. I would direct Joe to then maybe share any immediate feelings that he had coming up based on what Anna had just experienced, and really want to support Joe in sharing his full experience, his full range of feelings, whether that's anger, frustration, whether he's feeling some compassion for Anna, whatever it may be. We want to encourage Joe to really show up as he is in the moment. Okay, so the feminist group technique that I thought would be great for this situation is gender role analysis. So I'd begin with Anna, and I would ask Anna, what does being a woman mean to you? And tell us about your experiences as a woman and your relationship to gender. I would ask Joe to then maybe step in and ask him what he thinks Anna may be feeling right now as she shares this experience, which again would support Joe in developing some understanding of her experience as a woman. And it would differentiate and bring some empathy to him. And also Anna would be modeling some vulnerability and characteristics of just sharing honestly and openly. So then I would ask Joe, what characteristics do you identify with your gender and that you currently possess? And how do you think those characteristics have impacted Anna in this group? So bringing the immediacy in to the moment and to the current relationship and group dynamic that's happening now. So I also would talk about myself, I think, after that conversation, and hopefully there's some really nice, juicy revelations and that people are having within the group, and that the fighting to share the space from Joe is lessened. And I would also be curious to sort of bring in my perspective and state, you know, like as a woman, Joe, as a leader of this group or facilitator, what are your expectations for individuals who are in sort of the leadership facilitator role? And what do you normally, in your worldview, do you think facilitators and leaders possess as far as characteristics? And then I would ask Anna to share a little bit about her experience and what her expectations are. And then I would sort of ask everyone if they share any commonalities or differences in Anna and Joe's answers. So hopefully there's some modeling going around sharing openly, honestly, and vulnerably. And I think this would really help Joe and his anxiety, because he could connect to other people in the group who are sharing, who are becoming more in touch with different parts of themselves and not necessarily being subjective to the sort of oppressive gender binaries that often create a lot of emotional stress and challenges in our lives. So I hope you enjoyed my presentation. Sorry, it was a bit long. There's the other bubble right there. And the next slide is my references. Thank you so much for joining me, and I look forward to hearing questions and comments. Take care, bye.